Hello. Today we'll be talking about the complications of tobacco use during pregnancy. So the complications of tobacco use can be divided into obstetric, or those that affect mom, and neonatal, or those that affect baby. So the mnemonic we'll be using today is 4-pack. 4-pack. So we start with the 4 P's of 4-pack, which are P-Prom, PA, or placental abruption, pre-E, or pre-eclampsia, and PPrev, or Placenta Previa. Then we have the A for abortion, and the C for constriction. So these are all complications that can affect mom, and I'll explain them one by one. So the first is P-Prom, or preterm premature rupture of membranes. This is something that can occur as a consequence of tobacco use during pregnancy, and it's illustrated by this cigarette box all the way here on the left. Imagine that we're on a time axis here going from left to right. This is something that occurs preterm, hence it's all the way here on the left. Next we have PA, or placental abruption. This is when the placenta abruptly separates from the uterus, causing bleeding. And that's represented by the second cigarette box here that looks a little bit open. There's a cigarette popping out also. Next we have Placenta Previa, or PPrev. This is when the placenta is abnormally located at the opening of the uterus, known as a cervix. And we can see what looks like a cervix or a coaster here on the bottom. And our fourth P is pre-eclampsia. You can see that this cigarette box here is positioned above the other cigarette boxes, indicating an elevation of blood pressure, which is characteristic of pre-eclampsia. So these were the 4 P's. Next we'll move on to the A, which is abortion. This can be a consequence of tobacco use during pregnancy, unintended abortions. And the C is for constriction. Now this means constriction of placental blood vessels, and also which can lead to intrauterine growth restriction, or IUGR, and babies who are small in size. Now the K stands for kids, and we can derive the complications from kids from the ones that are already listed here. So the way I think about this is that kids, because they're constricted early on in utero, they have to sort of make up for being constricted by being larger later in life. And this leads to obesity and diabetes that affect children of moms who smoke. The other major factor that can affect kids is the development of asthma, or SIDS. And if you think about it, smoking causes airway irritation in mom as well as in baby, and this can lead to asthma in baby. And asthma is characterized by a reversible constriction of the airway. It can also lead to SIDS, or sudden infant death syndrome. So you can think about this as if there's a very severe reaction to smoke in the airway and baby cannot breathe, then they may die, unfortunately. And this would be the worst case scenario, the worst case consequence of tobacco use during pregnancy. I hope you liked this video. If it helped you, please consider subscribing and give this video a like.